I don't forget because it's been one of those days and I could forget.
Stephanie had a beautiful, beautiful hair. She's ready for I really like it.
Yeah, I love it. She did a little something different with the color. She kind of like added some rose gold in with the copper, so it looks really pretty.
Yeah. It's good on you, really. Like,
Thank
level, anong tawag doon anong tawag doon ano yung, parang, yung ano sa TikTok, yung uso yung nag-level up ng beauty niya. Well, I don't know in English, like your beauty was,
It was yeah. Well, thank you. That's sweet of you.
yeah, welcome. I don't know in English, but it is like everybody is like it's on TikTok, like the glow up. Yeah, there you go.
Oh, the
Yeah.
glow up. Yes.
Yes, glow up.
I had a
Oh,
glow up.
yeah. It,
Okay.
so your
So,
hair color really suits you.
yeah, I love it. It fits me. So,
Mhm.
I think this week it was I had one and you had two, I think.
Oh, is it too? Oh no, I should have. Okay, wait.
If you don't have two, it's okay because at this point I am so dead tired that I'm like, if we only have two, we only have two. Because I'm just like,
I'll find one.
it's just been so crazy for us.
Mm.
So, do you want me to go first and then you can do your two or
Or one, me first and then you.
yeah, you can do yours
Okay.
first.
Okay, so the first case is a 37-year-old man. He's looking for recommendation for his treating for his runny nose and nasal discharge. He says that his symptoms will is annually around this time of the year, adding that he is also suffering from irritated, itchy eyes and sore throat.
What was the technical term? Is it I'm gonna say allergies. I know it's like allergy something, the technical term. What is the
Yeah,
technical
nice.
term? What is it called again? It's like
Yeah, allergy. Yeah,
I'm
you're
like
there.
what was it called? What did they call it in the book? Like what was it?
Allergic rhinitis.
Allergic rhinitis. I'm like,
Oh,
okay,
yeah,
yeah.
Okay, I mispronounce it. I like the way you pronounce it. Allergic. I
I'm like, it's
pronounce it.
allergies. I'm like, I'm calling it what it is. It's allergies. I'm not calling it the medical technical
Yeah.
allergic rhinitis. I'm like, no, my brain's
Yay! You are so good. Yes,
it's not
good.
I'm not gonna remember that. The only reason why I knew what it was is because I'm like here, Sarah going sniffling because of my allergies. So
Yeah. So you got it correctly.
yeah, so
He
allergies.
got an allergic rhinitis.
Yes. And then I know that okay, I had to go look at what the treatment was. So basically, for treatment, you're going to want to manage the kind of environmental controls and like allergen avoidance. So you kind of want to try to avoid things that cause allergies like pet dander or dust. Try to do what you can, but you're not always going to be able to avoid it. So you can use intranasal steroid spray,
Mhm.
immunotherapy, allergy shots can help. There also is allergy medicines you can take to help. It just kind of I think depends on how severe your allergies are. Like for me,
Mhm.
mine is dust and cottonwood
Oh, you have an
trees.
allergy.
Yeah. So
Mm.
me, it's cottonwood trees and dust, and I take allergy medication and I'm okay. My sister is allergic to cats, horses, dust, cottonwood. Like
Oh,
she has more triggers with her allergies than I do. And I'm like, well, thank you that I am not allergic to cats because I'd be sad if I was. I love cats.
oh yeah, me too. I also love cats. Like I would really love, like, last year. I am hoping that I will have a birthday gift like those Persian cats I'm trying to save, but I wasn't
Yeah.
able to save because here in the Philippines it's quite expensive.
Oh yeah.
Yeah.
Yeah, it's crazy, but yeah, I got lucky.
Oh, I really love to hear that one. Like when you said that one, I said, "Wow, we also have again a common ground together."
Oh yeah, definitely.
Yeah.
Crazy. All right. So got the
Gladly you don't have an allergy with cats.
oh man, if I had an allergy to cats, I would take whatever I needed to take because I love cats too much to not be
Uh-huh.
able to be around them. I'm like, no, no, not doing that. All right. So my case, let me get this to pull up. Okay. So a 10-year-old girl comes into the clinic with her parents. They say that she's been coughing at night and it's been terrible. As
Mhm.
well, there have been acute episodes where she wheezes and can't breathe and has tightness in her chest. What do you think it is?
That she has a chest pain.
Yeah, so tightness in her chest.
Uh-huh.
When she has these episodes, she can't breathe and wheezes and has terrible coughing at nighttime. And she's 10.
Mm-hmm. Wait. Okay. But does she have a bronchitis?
No,
No.
but it could. I can
Uh-huh.
see how you could think that that is. Nope, it would be asthma. So, as asthma attacks can be very mild or they can be
Oh,
very,
asthma.
yeah. Asthma
Okay.
attacks can be very mild or they can be very
Oh,
serious.
there's a wheezing.
Yep, the wheezing. Yeah,
Oh, I forgot about that. Yeah.
yeah. If you're usually coughing at night is terrible. Things
Mm.
there are things that will trigger your asthma.
Yeah.
You can be more prone to bronchitis if you have asthma, or at least
Mm-hmm.
that's how it is for my mom. Poor thing. So
Oh,
yeah, it's
right. So thank you for bringing asthma because yeah, so asthma, the etiology of this is that you really need to identify or to really get the family history
yeah.
or the individual history.
Oh
Yeah,
yeah.
yeah.
Yeah. Yeah. I mean, I don't have it, but my mom and my sister both do.
Uh-huh.
So genetics can play a very big factor on if you get it or if not and stuff. So it's crazy. So basically, um, it kind of like it goes with the allergy things. You kind of want to try to avoid things that can trigger your asthma. Um, bad air quality can cause it. I know that my mom and my sister, when we have our kind of smoggy inversion, bad air quality out here in where I'm at in Utah, it can cause their asthma to flare up. It can even be your own allergies cause your asthma to flare up. It could be a whole bunch of things. So it's kind of like you have to figure out what triggers it and kind of try to avoid that or do what you can to reduce the inflammation that is caused. So, going with the treatment plan, you want to avoid the things that can trigger the symptoms, control the airway inflammation. Um, it would be good for like the primary care doctor to determine if she needs to be on long-term controllers or quick relief rescuers. So like, um, oh my gosh, I just forgot what the name of the thing is. Inhaler. There we go.
Yeah.
That's the word. I was like, my hand was I was doing the finger thing, and I'm like, what is it called? What is it called, brain? So you can have your long,
So yeah, like for the people who got asthma, like of course they are using the inhaler, right? Now, if the inhaler is gone, I mean, you know, like so they will
you,
have this tightening. So like if they don't have that, the possible what is the possible way if they don't have that inhaler?
yeah. So I mean, basically, you would have to get to a hospital because you could die. If
Yeah,
the asthma attack is bad enough, you could die.
yeah, right.
Yeah, so it's like you want to have your inhalers, you want to have your backup if just in case, but you also want to make sure, you're kind of finding what works for what level of severity you would have. It kind of just depends on the person themselves.
So
Uh,
that's why you really need to always bring with them their inhaler.
yeah,
But if the attack or asthma attack they will have to just
yeah.
spray it. Yeah, I don't know how it goes, but in the movie, I always watch movies with patients who have asthma, like you know, like in what is that movie? Oh, I forgot. Like the kid really wanted to have that, or else. Oh, is it the zombie?
Oh,
Yeah, the zombie by Brad Pitt.
yeah. World War Z.
Yeah, the Z Nation. Yeah,
Yeah,
because the kid is using
yeah.
the that
Because
one.
you
You
don't
watched it.
have
You
that.
also watched that one.
Yeah, that's one
Uh,
of my favorites. Yeah, you have to like, and if you don't have it, you have to kind of try and figure out a way to calm down the
oh yeah.
emotion. So if it's breathing, you do that. Sometimes the breathing it doesn't help. So if it gets to a point where you're doing other things and you don't have the inhaler and it's not working, you basically would have to get the person to the emergency room because they have to get some type of relief. Because basically it's like your airway is constricting and you can't breathe and yeah, it's no fun.
Yeah. That's why the mother in there and also Brad Pitt is trying to calm
Yeah,
the kid so that
yeah.
she can control her breathing or yeah technique. My son will go because there is there will be a home evening later on with some members or one family member house, and I told him that we will go, but his father invited him, and his father and me already separated a long time ago,
Yeah.
and he now has his own family. Like she had two daughters with the girl, so I told him, okay, go.
Yeah, you're like, all right, you can go.
Yeah.
Cute kid. Uh,
Thank you.
all right.
All right. So do you want me to say the other case?
Yeah, let's see if I can figure it out.
Well, you can. You are good at it. All right. So the patient is a 37-year-old woman presented with a history of cough for 1 week and a gradual onset of hoarseness and began 2 days before the visit. So okay. So he said that she got pain, dry cough, and also having a fever.
You
So
said that there was hoarseness in her voice.
yeah, there's a hoarseness in her voice.
Is it laryngitis?
Oh, you are so good. You hit it.
I know my laryngitis. I have been lucky enough to never have had it, knock on wood,
Uh-huh.
but I've had friends who have had it, and I'm like, man,
Like like they will, so before laryngitis will come, like you will have fever and also
oh
the
yeah,
voice.
yeah. I had a friend in high school who got
What
it.
what what is the factor that cause this one? Bacteria or viral infection, right?
Oh gosh, I can't even remember. What was
Yeah,
it?
it says bacteria or viral infection. Now, I am trying to remember if I had this before.
Yeah, because it says
Oh, there's no
acute.
no, I didn't experience laryngoscopy, so I don't know how
Yeah,
is that. I don't know how laryngoscopy is, so and
not
so
fun.
I think I don't have this too.
Yeah, yeah.
Do
So
you know,
acute laryngitis may result
yeah.
from
Do you know
bacterial
how
or
do you
viral.
know what is do you know what is laryngoscopy?
Blah 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 blah. Technically,
Laryngoscopy is because I don't know. I will try to search that one.
yeah,
Do
it's
you have an idea?
basically. I think it's a camera that goes down, and
Oh yeah.
yeah. Usually, when it ends in scopy, usually it's like,
Oh, they're going to flashlight or see
yeah,
something
yeah,
like it's only here on this part.
Yeah, because usually
Because
it
on the
feels like,
stomach, it is called endoscopy, right?
sorry, what?
Because in the stomach, it is called endoscopy. Like they're
Yeah,
also, yeah. So larynx, so
colonoscopy.
on the
Or
larynx only.
yeah,
Oh, yeah, right.
yeah,
Because I'm
they're all the same. Because what it does is it basically, if I remember correctly, it's like the camera goes down and it will show the red, inflamed, and
oh,
everything. I'm like, I never want to have to deal with that. No.
I will remember the word escopy because if there is an escopy in there, then there will be something put
Yep.
in here. Oh,
Usually,
wonderful. See, I am learning a lot from you. Oh my gosh.
because I know way too much information just because I've had way too
Yeah,
many
because you're
experiences.
smart. You see, in the church, like I am when I am trying to wait for the meeting, like I'm trying to see. I really wanted, like I am really planning, like okay, so when the step is in the Zoom, I will let my friends in the church will say hi to you, and then after the meeting, I said, oh, I think she cannot go yet, maybe on other time. Because
Oh,
I really wanted them to know you because I told them that I have a smart good friend from America. Yeah. And because of her I'm almost dropping out my course. But because of her I told them that um I really like the way she treat me and she's really smart when we are doing the video call. So I wanted you to meet that member from America. So we will have like friends. And
that's
and,
so,
and two of my co-leaders in primary, like they're also waiting. I'm also waiting for your message in the tablet. Like I am worried because the internet connection is so it's weak in the church. So I asked Bishop, I have an assignment to do. I am waiting for my partner. And I said I'm waiting for my partner, which a very she's a good hearted person, and she's a member of the church. Oh.
yeah. Oh, yeah. I try my best. I do my
Yeah,
best.
thank you. And I really okay, so before the Thanksgiving they will arrive, I will express my thanks of appreciation to you, all the
Oh,
things you're doing. Yeah. And because when I got you in here, like having our Zoom meeting and virtual, like I feel comfortable. I feel at peace because I know that you're a good person. And when I did mistake, like for example, you understand me. Like there's no barrier with like you never told me about anything about the language. Like you understand me. You are really trying, even though I really cannot pronounce the word, you still try to understand. That's why I'm really thankful to you.
oh,
Thank
well,
you.
I'm thankful for your kindness, and
Mm.
I appreciate you and what I've learned from you. And I love our meetings. I think they're
Oh, me
fantastic.
too. But of course, I'm going to mark it on my calendar that every Friday, even though I will have a report, I really
Right? You're like, listen
so that
here.
I will not miss your time. Yeah, I will not really miss your time.
Right. Time
Hmm.
change always just messes me up. I'm like all discombobulated and I'm like, takes me forever to get adjusted. And then just by the time I get adjusted, we switch back. I'm like, no.
And also because of the additional 1 hour, like an additional 1 hour, then I am really thinking, what is the? Oh gosh, like I did I miss the Zoom meeting now? Yeah, so we will still be 9 my time, like the same time. There's no advance of 1 hour. Is that right?
Yeah, because the time doesn't change until like March.
Mm.
So by the time it changes again, this semester will be over. So we'll be good. But I just am like, man, why this time around it got me all messed up? I don't know.
Yeah, so we
So
will stick on that, right? Like on Friday, that will
yeah,
be 9 a.m. and that will still be your 7?
Thursday. Yeah, it'd
Yeah,
be my
Thursday, 7 p.m.
Thursday, your Friday.
Right,
Yeah.
right.
So
There's
before I
still nine.
forget, because I almost forgot.
Mm.
So laryngitis is really like really easy
Yeah,
kind of
laryngitis.
treatment. It's resting the voice is necessary.
Mm.
If there's an underlying disease or disorder, you have to diagnose and treat those. Antibiotic therapy may be necessary if a bacterial infection is causing the
Mm.
condition. Medications to reduce acid reflux may be prescribed. So it's just kind of like, eh, kind of taking it easy, like, not overdoing it, resting your voice. So not too bad, but
No karaoke.
right. No karaoke, no singing. No, no singing. Yeah, my friend that got it in high school, like she was so bummed out because she was like in the choir and everything. She's like, why? Why? And it's like she was so mad because she couldn't talk, and she's just like, we were passing notes back and forth. She's like, I'm in choir and I just want to sing and I can't. He's
Oh,
like,
that's
I'm
too
so
bad.
frustrated. I'm like, well, do what the doctor says, and then you get back to singing. She's like, I don't want to. I'm like, you're going to. She's like, fine. It's like she got better, and she's like, thank goodness it didn't last as long as I thought it was. I'm like, yeah, because you listened to me. Because I told you to listen to what the doctor said. She's like, shut up. I'm like, you're welcome. But yeah, so we
So
did it.
after taking this, like you okay, so I know that you have another, this is only an additional courses from the original degree that you're taking up. Don't you want to become like doctor or something, or maybe
Nope.
medical?
Nope.
Okay.
There's too much in the medical I just could not handle. I do not do well with blood at all.
Mm-hmm.
Mm-mm. I can watch a horror movie, no problem. My own blood, somebody else's blood, I just I couldn't do it. I'm fascinated by what our bodies do, but I could never be a doctor.
Yeah.
Uh-uh.
I am
No.
also I am also thinking like after this certificate, because this is my first certificate. I don't know if I'm going to change my degree, like maybe family history. I don't know.
Yeah,
But
I mean,
I'm already thinking because I really can't, like especially with this communicable and non-communicable. I said I think my brain is freezing.
me every day, my brain just goes whoop. Yeah, it took a while for me to settle on what I was going to do for my degree, and it's understandable to change your degree, it's I've changed my mind before, and I finally found something that works for me. So it's all just about balancing, finding balance and what works for you and what you feel is going to be the best course for you. So I'm like,
I totally agree with you. All right. So what is your time in there? 11?
it's like 11:08.
Oh, 11. Oh, so you also extend like the 1 hour time. Isn't that correct?
Sorry, my mouth was full
Oh,
of.
it's okay. Because 11:59 usually before, when there's no like the MDT or mountain saving line, isn't it? Like MST?
Yeah, so Mountain Standard Time. So
I standard. Okay.
yeah. Yeah, so it's 11:09 right
Mm-hmm.
now. If it
Mm-hmm.
wasn't daylight saving time, it'd be 12:09. So
Mm-hmm.
in the fall time, we fall back an hour. In the
Mm-hmm.
springtime, we go forward an hour. It's
Mm-hmm.
annoying. I wish we wouldn't.
Yeah,
I wish
like
we didn't have to.
you are not also used to that kind of time.
I it gets to a point where I'm okay with it, but
Huh?
because the time changes, it messes up my sleeping patterns,
Oh
which
yeah.
then causes my autoimmune disease to flare up, which causes my ADHD to get all out of whack. So,
Mm. So also it is also a factor that can cause something on us, right?
yeah,
I'm
yeah,
so glad that we have. I mean, we are not changing on our time.
yeah. I mean,
Yeah.
and Arizona doesn't change their time. They're one of few states that don't, and I'm like,
Yeah.
can we just do it like Arizona and not go back and forth because I'm exhausted every single time.
So when you do that, for example, when you do that, like for example, you are going to um your work like 7 a.m. and then because the time will change, then you will go around like another extra 1 hour to have your 7 a.m.
Yeah, so it's basically like during the
Oh, so
fall
they change
season, I
you.
gain an hour
Everything
of sleep.
change.
I gain an hour of sleep, and then in springtime we lose an hour. So yeah, it messes with my sleeping pattern, which just does not help. And the weather
Fun.
changes too at the same time, so I'm fighting both things at once, and I'm like, I'm so tired. So
Yeah.
this week has been like just a weird week between work and everything, and I'm like, I woke up this morning and I was like, oh my gosh, I want
Oh,
to get out of bed. But I'm like,
sorry.
I need to get out of bed. I'm like, I slept through my alarm. I got to get ready because I have my hair appointment. I'm like, oh my gosh.
Yeah. All right. So on 23, that will be your Thursday, right? So
Yes.
the Thanksgiving will start. Like the turkey, everything, meeting with the family, that will start. I mean,
Yeah.
on the
So
23.
we should be done we should be done by 7 o'clock. We should be done before 7 o'clock. Because usually we do it like around three,
Oh,
4. And it's just
oh,
gonna be my parents and me and my sister. So it's not like over the board extravagant like it has been in past years. So
huh?
it's more low key. So by the time 7 rolls around, we'd be done. So it's not like us meeting would cut into the
Yeah.
family time.
Yeah. What, how is, sorry, I have a little question. So Thanksgiving Day and Christmas Day, do you also celebrate Christmas Day or purely on Thanksgiving? Is it the same like when you celebrated Thanksgiving and Christmas or different?
It's different. I mean, Thanksgiving is, it's all about giving thanks,
Turkey.
and
Because when I see Thanksgiving Day, there are lots of
yes.
turkey in the table. Like I mean,
Oh yeah,
oh,
turkey, mashed potatoes, rolls, all that stuff. They're different holidays. Christmas and Thanksgiving are different, but there's a lot that goes into it. I mean, Thanksgiving is all about, giving thanks and everything. And it's a holiday that started like way back in the day, way, way, way back when America was first founded. But, it's just, I'm thankful all year round, so, but I'm like, hello, I love food. So yeah, I'll eat it.
I love food
Christmas,
too.
Christmas is all about the holiday spirit, and the birth of Christ and giving back to, those around us. It's just they're celebrated different, but there's two big holidays. So it's like it goes Halloween, Thanksgiving, Christmas,
Oh
and
yeah,
New
and you
Year's.
celebrated Halloween too. Like when it's Halloween because of you in the Philippines, like because of America. Now Philippines is copying the trick or treat from America.
Yeah.
We don't have that. Like we will just go in the cemetery, and now some houses is decorating.
Yeah.
Those kind of fancy decor when the
Well,
squash or the lantern or whatever it is so much fun. Like and on the Thanksgiving Day because you have turkey. Like can we also have that on New Year's Eve like in the Philippines?
yeah.
But we don't have the turkey like
We eat
something like.
turkey whenever we feel like eating turkey.
Uh,
I mean, we've had turkey before on like, in
I
April
also
21st.
wanted to see that big chicken on the
Oh,
table.
seriously, 16. My mom thought she was getting a small 13-pound, female turkey, which is basically called a hen. No, it's 16 pounds, and I'm lifting it out of the back of the trunk on Thursday night. And I'm like, oh, this is heavier than I thought. I'm like, what is with this turkey? And I'm like, oh, it's 16. Okay, that makes sense. But yeah, it's, you can get turkeys and they can be pretty big, pretty small. It just depends on your size of the family. But, everybody cooks their turkey different. You know, um, some people will like broil it and fry it and stuff. And I'm like, it's weird, everybody has their own traditions for what they do for Thanksgiving and for Christmas and everything. So we all celebrate it differently, but still celebrate the holidays. So I love them. it's just I love being around family. So
Yeah, thank you. Thank you for sharing that, Estelle.
um
Again, it's so good to see you. And with your fuzzy hair in
I
there.
know my fancy hair. I know. I
Yeah.
like
I
love
also
it.
want I also wanted to have a hair color, but the hairdresser told me not to because during the when I have my I don't know if you believe this one, but when I have my the vaccine, the
Yeah.
number two vaccine, yeah, the my hair I have a hair loss during that time, and I got sick, and then I have this vaccine, and then I had a hair like severe hair loss. So he told me not yet to, you know, like not yet to extra or put extra color in my hair, but I really
Yeah.
wanted to have a color now.
Yeah, it's hard because you've got to because you're basically putting a chemical on your hair, and changing how it looks. And if you've had hair loss, it's kind of like, oh, like you want to do it, but like you have to also be careful because hairs can be fragile sometimes.
My those hair that I lost, like basically this part, so they are growing now, like they can they
Yeah,
yeah, they are growing now like this. But of course my hair become thin, but because of the malunggay shampoo, I don't know in English, the malunggay. So I'm using that one, and it's making my hair a little thicker now.
yeah,
Like it's growing.
it's crazy what our body can do to us and how our body reacts to things. I'm like, oh,
Yeah, I think
right.
that's a side effect. I think I had that side effect of getting the vaccine.
Yeah, it was funny. Every time I got it,
Mm-hmm.
um, it interacted with my body.
Oh,
My fibromyalgia didn't like it, and so I had a
mm.
flare up, but then
Oh,
also be really sick at the same time. So I had
yeah.
the
Like
flare
you
up.
have a fever too?
Yep, the
Yeah,
flare.
same.
Yep. I'm
And I
like,
am chilling. And I yeah.
but it
And
was,
I'm weak.
but it was like, but I figured out that because we got the Moderna version of it, and that
Oh,
is more potent. So it can kind of be a little bit more woo to your body because it's a little bit more potent than the other versions were. And I'm like, heck, I will put up with a day or two of feeling a little bit eh to not have to worry about getting COVID. I'm like,
yeah. Same
look,
same
it's a
as
couple of
my
days
father.
of
He got
discomfort.
Moderna too. But my sister had the Chinese one, the got me the first vaccine that they are
Oh
recommended.
yeah.
One from Chinese. I forgot. I forgot about it. So we have Moderna, we have Pfizer, and we also have that one, the first one. It starts with letter C, I think. Oh gosh, my memory.
I know. I'm trying to remember. I'm like, what was it? What was it? I'm like, I don't remember
Yeah,
now.
yeah, yeah.
Too
Yeah.
long. But yeah,
Mm.
so yeah, I was like, I will put up for a couple of days of discomfort than actually getting the disease and not knowing what my body will do. So I'm like, I'll survive. But I will go ahead and get
Yes.
everything typed up and I'll get this submitted. So
Thank you.
should be good to go. So, well,
Thank you for all that you do.
well, thank you for being amazing and being patient while I figured out what was happening with this crazy week. It's a crazy week. So
I'm sorry also. I think I also one of the factor that changes your, like like the time.
we're good. We're
Mm.
good. Like I said, things
Fine.
things
Yeah, I'm so
happen.
glad that we're beautiful.
We're fabulous. We roll
Yeah,
with the
we're
punches. We got this.
yes, we got this.
We're good. So,
Yes, we're good.
but you have a great rest of your day.
Yes. And you to have a good rest night.
I'm going to. I'm gonna
Yeah.
get this turned in and then go to bed.
Yeah. I am looking at you while eating, so I also wanted to I also wanted to eat.
I know I'm like, I need to take my antibiotic and I'm like, oh, I
Uh-huh.
need to eat something so I don't get sick. Because if I don't eat something before I take the antibiotic, I can have side effects. So I was like, okay, I'm just gonna eat a
Oh, okay.
quick little snack and I'll be okay.
Yeah. I also would want to. Okay. Bye.
Bye.